In today's video, I'm going to be using this diagram to fully explain most of the possible causes of you not getting pregnant yet. This video is for those of you that have been trying to get pregnant and it has been unsuccessful. In today's video, I'm going to be telling you all of the reasons or all of the common reasons why you have been trying so hard to conceive and it's been unsuccessful. And I am going to be telling you all of the tips and secrets on how you can overcome all of these challenges in order to get pregnant. If you are new to my channel, this is all I do. I talk about infertility and the treatments, the solutions, how you can help yourself, when you should see a doctor. I am Dr. Amarachi Ijoma, so if this is the kind of content you are interested in, keep watching. So ladies and gentlemen, this is the uterus. And in today's video, I'm going to be using this diagram to fully explain all the possible causes of, or most of the possible causes of infertility, most of the possible causes of you not getting pregnant yet. So this is the vagina. This is usually where the penis deposits sperm, just around this area. So this is the vagina. This is the cervix. So this whole area here is the neck of the womb. It's called the cervix. It's the neck of the uterus. This is usually where the baby comes out from. It's usually closed until labor. When the baby is about to come out, then it dilates. It opens up for the baby to come out. The baby passes through the cervix, into the vagina, and out into the environment, into your hands. So these are the ovaries, and the little circles you're seeing, the little dark circles you're seeing on the ovaries are called follicles. They are like sacs of fluid, sacs that contain water, like fluid-like substance that contains the egg. So on the ovaries, or rather in the sac of fluid, in the follicle, the egg is suspended in the fluid. And these red dots you're seeing here are the eggs. Then you have the fallopian tubes. These and these are your fallopian tubes. So this whole area you're seeing here is actually the uterus. Every other thing that I've mentioned right now are other organs that are connected to the uterus. And then we call this place the cavity of the uterus. This is usually where the baby lies. So now that I've brought you guys up to speed with what the uterus looks like, what your reproductive organs look like, now let's get down to business. For pregnancy to occur, a sperm must meet an egg. So fertilization will occur when this happens, and then a baby will be formed. So for this sperm and this egg to meet each other naturally, sexual intercourse must occur. So this is what happens when you have sex. The penis enters the vagina and then deposits the semen into the vagina. So these are sperm cells from the semen. Because what you actually see when a man ejaculates is actually called the semen. The semen is the fluid that you see when a man ejaculates. But inside the semen, there is sperm, but you can't see the sperm. The sperm makes up only 5% of the entire semen, and you cannot see it with your naked eye. So now, even though I said 5% of the entire semen, that 5% amounts to millions of sperm cells. And guess what? We only need one sperm cell to fertilize the egg. So the journey begins from here. Then they start to enter through the cervix into the uterine cavity. So these are the sperm cells still moving. It's usually like a race, but only one is going to get to the egg. It's usually the fastest one that will end up getting to the egg. For an egg to be released, ovulation has to occur, and ovulation is simply release of a mature egg from the ovary into the fallopian tube. So now in this case, this egg has been released. A follicle grew so big and then ruptured, and then the egg has been released. Then this is the fimbriae, like the hand of the fallopian tube, which will pick up the egg. And then the egg will migrate all the way to this place. And then wait for the fastest sperm to come and fertilize it. Then when this sperm gets to the egg, fertilization is said to occur. Now, when fertilization occurs, this becomes the zygote. Then it then takes about 5 to 6 days for the fertilized egg, which is the zygote, to actually journey into the uterine cavity, and then when it gets here, it implants. So implantation usually occurs inside the uterine cavity. So this is your implantation. So if fertilization is this straightforward, why are you not getting pregnant? There are several reasons that can prevent fertilization from occurring and hence prevent pregnancy from occurring. Let's start with the sperm. If the sperm is not able to do all of these things that I talked about, then it's never going to be able to meet the egg, and then fertilization would never occur. So what can cause the sperm to not be able to meet the egg? One, if a man has low sperm count. Sperm count is said to be normal when a man releases at least 20 million sperm cells per mil of a particular ejaculate. Some experts say when a man ejaculates at least 15 million sperm cells per mil of a particular ejaculate. But how do you know how many million sperm cells that you have ejaculated? That's easy. You have to do what we call a semen analysis. You go to the lab and then you produce your sperm via masturbation into a container, and then the lab scientist runs the test for you. Also, remember I said that it's like a race. Only the fastest sperm is going to fertilize the egg. So if the sperm cell is not fast enough, that is, if its motility is reduced, it can also prevent fertilization. Sperm has a particular shape, so if the shape of the sperm is distorted, then it could be a genetic or a DNA problem, and then it's going to also affect the chances of the sperm actually meeting the egg for fertilization to occur. So when you're not getting pregnant due to a problem with the sperm, there's actually solutions for it. First, you will need to find what is the cause of my sperm being abnormal. So I'm going to be mentioning some lifestyle habits that studies have shown that affects the sperm. We have smoking, excessive drinking, excessive weight gain, excessive weight loss, heat around the testes, and this could be gotten from placing your laptops directly on your thighs while working, or visiting the sauna very frequently. Sauna is an enclosed space where the temperature is set to be high for various reasons, but this sauna can actually affect your sperm production. Also, there are other causes like genetic abnormalities, DNA problems, even certain medications. For example, antidepressants. If you're on antidepressants, it can actually cause low sperm counts. So if you have been able to identify your lifestyle habits that can potentially affect your sperm production or sperm motility or sperm shape, then you have to try to address those causes. If it is the sauna that you visit frequently, or you're always in a jacuzzi, a hot jacuzzi, then you have to stop. And if you stop, you will notice that within 2 to 3 months, your sperm count will return to normal. It will increase again. And this is because it takes about 3 months for the sperm to be produced in the body. And also, research has shown that when men stop going to the sauna, or stop entering the hot jacuzzi, or stop putting their laptops directly on their thighs, within 3 months, the sperm count returns to normal or simply increases. There are also prenatal supplements for men. Yeah, it's not only women that take prenatal supplements. So some men take prenatal supplements. And these supplements help to actually increase the sperm count and help with the sperm health in general. But this is not absolute. So some men may use these supplements and it will help with their sperm health, and for others it wouldn't. So like I said, you need to visit a specialist to find out what the cause of your sperm abnormality is. So while shopping for that supplement, there are 2 important ingredients that you should look out for in a male prenatal vitamin, and they are zinc and CoQ10. Several studies have shown that CoQ10 helps to improve the movement of the sperm. That's the motility of the sperm cell, how fast your sperm can swim to get to the egg. And then for zinc, it's not just the movement that is improved, even the sperm count is improved. So if you want to know other ingredients to look out for in your male prenatal vitamins, I'm going to put a link to a video where I talked about male prenatal vitamins and all you should look out for in a male prenatal vitamin. So another reason you may not be getting pregnant is, as a woman, remember I said this is the neck of your uterus. This is where the baby comes out from, and it's usually closed until during labor. Also, it slightly opens during menstruation so that the blood coming from here can actually come out. On the cervix, some women have what we call a growth. This growth is called a polyp. And sometimes the growth is like this, big enough to block the cervix. Most times you don't have any symptom when you have a polyp. So it's usually during a routine vaginal examination that your gynecologist may just stumble upon it and be like, oh, you have a polyp. But for some women, they have excessive bleeding and long duration of bleeding. So it's important that I mention that polyp doesn't always cause infertility. It can sometimes cause infertility. And the treatment to this is simple. During that vaginal examination, when your gynecologist stumbles upon it or your healthcare provider stumbles upon it, what they do is they just do a minor procedure to take it out. If it is a smaller polyp, they'll just use a forceps to twist around the stalk and take it out. And then it's usually an outpatient procedure. You go home the same day and you're fine. So I know that my uterine cavity, where the baby is supposed to lie, I know that I have drawn it as this wide space. Yes, it's a space, but it's usually collapsed on itself. So imagine there is an injury or an inflammation in this cavity. And remember I said it's collapsed on itself. Then when it's healing, it will heal together and then fuse together. We call this adhesion. And one of the causes of uterine adhesion is untreated sexually transmitted infections. So again, you can prevent sexually transmitted infections simply by avoiding multiple sexual partners or using condoms. When you use condoms during sexual intercourse, you protect yourself. So your question may be, but the penis cannot get all the way into the uterine cavity. So how is the sexually transmitted infection causing injury to my uterine cavity? The explanation is, even though the penis stops here, once the infection starts from this area, your vagina. But one thing about sexually transmitted infection is that it can ascend. It will go through the cervix into the uterine cavity. Sometimes it even gets all the way to the fallopian tube. So it doesn't only cause injury and scarring in your uterine cavity, it also causes injury and scarring in your fallopian tube. And if this happens, sperm cannot get into the uterus because remember, the scarring has caused it to heal on itself. So now this space that the sperm is supposed to go in through is now closed up due to the adhesions, due to the scarring, and then fertilization will not be able to occur. Because remember, the egg is usually here. When the egg is released from the ovary into the fallopian tube, it's usually here. So if the sperm cannot pass here because there is scarring and no space for it to pass, or let's just assume that the scarring didn't occur here, but went all the way here, the injury here was so severe that the scarring occurred here. Even if the sperm gets into the cavity, it wouldn't be able to pass into the fallopian tube and get to the egg, so pregnancy will not occur. So the treatment depends on the type of STI. So we have the bacterial STI, which is the chlamydia, the gonorrhea, the syphilis, and then we also have the viral STIs. So treatment depends on which it is. So again, you have to visit your healthcare provider so that you can be properly evaluated and the cause of the infertility is found. If it is a bacterial STI and your healthcare provider catches this early before any major damage is done, then treatment, once you do your complete course of antibiotics, you're good to go. You'll be completely healed and it shouldn't affect fertility. But if complications have already occurred, that is injury and scarring, you will still get treated with antibiotics to prevent further damage, but then you will still need your healthcare provider to perform a procedure that will help to open up the uterine cavity if the scarring is limited to the uterine cavity. But if the scarring has gotten all the way to the fallopian tubes, we'll get there and I'll explain that to you. But if it is a viral STI, there are some viral STIs that have treatment and then there are some viral STIs that have management. That is, it cannot be completely treated, but it can be managed. For the ones that can be treated, for example, human papillomavirus, there are treatments like cryotherapy or LEAP, but for the ones that can be managed, they will be managed. Another cause of infertility that can happen in the uterine cavity is actually fibroids. But this one is interesting because not all fibroids cause infertility. Fibroids is actually very common. Out of every 10 women, about 2 to 8 women will have fibroids and they'll go on living a normal life. It's not a death sentence. people with fibroids have gone on to give birth to multiple children. They've gone on to live to their old age, and most times you wouldn't even have any symptoms. Now, fibroid might now become a problem if you have symptoms. For example, if you're bleeding for a long time, normal bleeding duration is 2 to 7 days. But when you start bleeding for 14 days, 21 days, 58 days, that is a common symptom of fibroids. And then that's an alarm. You go and see your healthcare provider. Now, when are we concerned about fibroids with regards to fertility? There are 3 locations on your uterus that fibroids can occur. And I should actually define what fibroid is. It's a growth. It's not cancerous. It's not a cancer type of growth. But it's a benign growth. That is a growth that is not cancerous. So it's a growth that arises on the muscle of the uterus. Remember when I shaded these parts of the uterus and called it the muscle? Yes, that is where fibroid usually grows. When a fibroid occurs on the inner wall of the uterus, for example, here, it's called a submucous fibroid. But when the fibroid occurs within the muscle of the uterus, it's called an intramural fibroid. And when it occurs on the outer wall of the uterus, it's called subserous fibroid. So when this fibroid occurs on the outer wall of the uterus, like this subserous fibroid here, or within the muscle of the uterus, like the intramural fibroid, we are not worried about infertility. Now, when the fibroid occurs on the inner wall of the uterus, then we might be worried. Now, I say might because not all the time. So why are we worried about a fibroid occurring on the inner wall of the uterus? That's because, remember I said that this zygote, this fertilized egg here, is going to actually journey for about 5 to 6 days and come here to implant. Remember that this was our implantation, right? So imagine that the zygote, the fertilized egg, was trying to come and implant somewhere here. But this fibroid is already taking the space that it wants to implant. Then infertility might occur. But remember, you have 2 fallopian tubes and you have 2 ovaries, so fertilization can occur on either side. But then again, this zygote, this fertilized egg, when it travels on the 6th day, it mustn't be here that it will decide to implant. It can look for anywhere, implant here. It can look for anywhere, implant here. And another thing is, remember you have 2 fallopian tubes. You also have 2 ovaries. So ovulation, that's the release of mature egg, can occur anywhere. So if the ovulation occurs here, and then the fertilized egg travels all the way, it can decide to implant here, it can decide to implant here, it can decide to implant anywhere. So how this submucous fibroid can prevent you from getting pregnant is if it prevents implantation. That is, where the embryo decided to fertilize, that's the place that it decided to stay, then it can prevent fertility. Another thing is, sometimes even when implantation occurs here, studies have shown that pregnancy hormones have been implicated in increase in size of this fibroid. So imagine your baby is growing here and is growing and growing and growing, and your fibroid is growing at the same time. At some point, there will be no space. And if there is no space, it can prevent the baby from growing the way the baby is supposed to grow and can lead to complications like death of the baby inside the womb. So that's the reason when a woman with submucous fibroid gets pregnant, she's followed up more frequently than a woman without submucous fibroid. That is, for antenatal care, if other women without submucous fibroid or without any other complications are going once every month, a woman with submucous fibroid will be asked to come more frequently, depending on the doctor's evaluation. So bear in mind that it's not every time that the fibroid grows, and sometimes it doesn't even grow at a fast pace. So pregnancy can occur till term, till 9 months, and delivery can be successful. So when next you're diagnosed with fibroid, you need to ask your healthcare provider, what is the location of this fibroid? What is the size of this fibroid? So like I said, you may not even need treatment, but if you do need treatment, treatment is simply surgical removal of this fibroid. Research has shown that a lot of women with fibroids are vitamin D deficient. So if a lot of women with fibroid are vitamin D deficient, if we give these women vitamin D, will it reduce, will it shrink, will it help with the treatment of fibroids? This brings me to other studies that have shown that in the lab, vitamin D was introduced to fibroid cells and it actually helped to reduce the size of these fibroids. Also, another study showed that 1,000 women were followed up for 5 years. It was an observational study, and they noticed that some women that didn't have fibroids before that started having fibroids, and for women that had fibroids were all women that had vitamin D deficiency. And within the 5 years, some of these women, their fibroids reduced in size. And when they checked, it was because their vitamin D levels were higher compared to the other ones, that their fibroids didn't reduce in size. As interesting as these studies are, it is not conclusive. But hey, it's a cheap and safe treatment. It doesn't hurt. We need vitamin D in our body anyway. Also, anti-estrogen medications can also be used in management of fibroids, but we usually don't use this for a long time because of the side effects. And because of this, after a while, the fibroids can recur. So for now, the only definitive treatment is actually surgery. So another reason you may not be getting pregnant is if there are problems with the fallopian tube. Like I said, anything that causes injury to the fallopian tube can cause it, because all of these organs you're seeing, I know that I drew them with space so you can see the sperm moving, the egg moving, but usually, even though they are hollow organs, they are collapsed on each other. So like I mentioned, sexually transmitted infection can cause injury to the fallopian tube. Another thing is ruptured appendix. That's interesting. So imagine something happening on your lower abdomen affecting your reproductive organ. So sometimes if you have a history of ruptured appendix, the appendix ruptures because inflammation has occurred. Now that inflammation, sometimes if the appendix is facing the reproductive organ, it can come here and actually cause inflammation of the fallopian tube and cause scarring of the fallopian tube when the fallopian tube is trying to heal. Also, complications from pelvic surgeries such as cesarean section or even some gynecological procedures being done can actually lead to injury in the uterine cavity. So yes, pelvic surgeries can cause injury and scarring to the fallopian tube, but the major cause of infertility due to problems with the fallopian tube is what we call pelvic inflammatory disease. And pelvic inflammatory disease is when a sexually transmitted infection has ascended all the way to the uterine cavity and into the fallopian tube. So how this prevents you from getting pregnant is, like I said before, the sperm is unable to pass through something that has healed on each other, something that scarring has occurred, and it prevents that sperm from getting to the egg and prevents fertilization from occurring. But bear in mind that sometimes blockage of the fallopian tube can occur in one fallopian tube or both fallopian tubes. So if it occurs in one fallopian tube, it does not definitely prevent you from getting pregnant. It just reduces your chances of getting pregnant. So imagine that this is the tube that is blocked, and then this month, this is where you ovulated. It's impossible for the sperm to get to the egg to fertilize the egg. But if this month, it is actually in this tube that you ovulated, and the fastest sperm gets to the egg here, then there's a possibility of you getting pregnant. So personally, I have had clients with unilateral, that is one-sided fallopian tube that is blocked, and they got pregnant naturally. So it is possible. It just reduces your chances of getting pregnant. So for now, the only treatment available for blocked fallopian tubes, that is, if both tubes are blocked, there's no way for the sperm to actually meet the egg. So in this case, the only treatment available for now is what we call IVF, in vitro fertilization, because in vitro fertilization basically bypasses the fallopian tube. All we're interested in is we're going through your vagina and going all the way to your ovary to collect, to retrieve the eggs. And then we take the eggs out of the vagina, like we take the eggs from the ovary, and our instrument is going to come out through the vagina, and we put the eggs inside the dish, and then we put the sperm, because the man will produce the sperm via masturbation, and then we take that sperm, we've already washed the sperm, we put it in a dish, and then we allow fertilization to occur in the dish. Like the fertilization is occurring in that dish in an incubator. So you see that fertilization that usually occurs in this ampulla here, in the fallopian tube, is going to be occurring in the dish, in the incubator. And then by the time the zygote is formed, we wait about 3 to 5 days, and then the resultant embryo will just carry it through the vagina and we'll just place it here. Now that embryo will now find where to implant. So for now, that is the only solution if you have bilateral, that's both fallopian tubes blocked. Now, what if the problem is with the ovaries that is preventing you from getting pregnant? One of the problems with the ovaries is problems with ovulation. And some of you have heard, oh, your prolactin is too high. Prolactin is a hormone that is produced from the brain. So one thing that is interesting about your reproductive system is that it usually communicates with your brain. Your brain is sending messages to the ovaries is responding, it's producing egg, telling your brain back that, oh, I've produced egg, oh, it's time to stop, sending me these messages that I should keep producing it. It's just like an interesting relay system of information. Now, your prolactin level is only supposed to be high when you have given birth so that you can be able to produce milk and breastfeed your baby. But when it's high without pregnancy, it actually prevents ovulation. It sends a message to the ovary that you cannot be ovulating right now. So, and remember, if ovulation does not occur, which is actually the release of mature egg from the ovaries into the fallopian tube, if that doesn't occur due to high prolactin level in the body, then pregnancy cannot occur. But there's a treatment for high prolactin levels. Medications include bromocriptine or cabergoline. So it's important for me to note that there are several causes of high prolactin levels in the body, and then you have to get evaluated to find out the exact cause of the high prolactin level in your body, and this will determine the treatment, because sometimes it might be a growth in your brain that is causing the high prolactin level, and surgery, a brain surgery, will be required. I should also note that for you to know if your prolactin level is high, sometimes you may experience symptoms like breast discharge, milky breast discharge. But the good news is, regardless of what the cause of the high prolactin level is, there's a treatment for it. Another ovulation problem is what we call PCOS. This one is very common. It's simply polycystic ovarian syndrome. For you to be diagnosed with polycystic ovarian syndrome, you have to have 2 out of 3 criteria. Now, number 1, irregular period. So this criteria is actually called few ovulations or no ovulations at all. The normal cycle length is 21 to 35 days. What is a cycle length? A cycle length is simply the number of days in between your period, counting from the very first day you see your period to the last day before you see your next period. Now, this number of days should be between 21 and 35 days. But once it is above 35 days, it is called irregular period. And for women with PCOS, they usually have irregular period. That is, their cycle length is greater than 35 days. For some of them, in 6 months, they haven't even seen their periods. Some of them in 3 months, some in 8 months, some in a whole year, they might not see their period, or they might see their period once. Then the second criteria is what we call hyperandrogenism, but I'm going to break that down for you. Androgens are male hormones. So when a woman begins to have more male hormones than female hormones, then that's a problem. It causes hormonal imbalance. So usually when this happens, a woman now starts to have hirsutism, that is excessive hairs on her body. You'll see like she has beards and she has like excessive hairs all over her body, on her chest, on her lower abdomen. This excess male hormone can also cause acne, like difficult to treat acne. And then the third criteria is polycystic ovaries. That is, she has more than, remember I told you these sacs of fluid here, these little black circles on the ovaries are sacs of fluid that contains the egg. That is, the egg is suspended inside it. So the third criteria is called polycystic ovaries. That is, when the woman starts having greater than or equal to 12 small follicles measuring 2 to 9 millimeters on her ovaries, then that's called a polycystic ovary. And usually when you do an ultrasound scan, you see them lined around the edges of the ovaries. Let me show you. So this is something similar to what a polycystic ovary looks like on an ultrasound scan. So in PCOS, it's not like the brain is not communicating with the ovaries. It's just that communication is impaired. Like the brain keeps telling the ovaries, oh, grow your follicles, grow your follicles, grow your follicles. I'm sending you this hormone to help you grow your follicles. But then the ovaries are not responding. The ovaries will take 2 months, 3 months, 4 months, sometimes 6 months, 7 months to actually finally respond. But when it does respond, it does grow. And when it does grow, ovulation does occur. So that is the thing. PCOS does not mean that you cannot get pregnant. It just means that your chances of getting pregnant is reduced compared to someone without PCOS. So PCOS can be managed. So some of the medications we use for PCOS are to help you ovulate or to help you reduce symptoms. So if you're trying to conceive, then we give you medications to help you ovulate. So one of the medication is called combined oral contraceptive. That's contraceptive pills that contain both estrogen and progesterone. Now this helps to regulate your menstrual cycle. So by the time you take the pill for 21 days, the 7 days in between, you are meant to bleed. Also, these contraceptive pills help to reduce symptoms like the excessive hair and the excessive acne. Medications like Clomid and Letrozole helps to induce ovulation. And one of the side effects of this medication is actually multiple pregnancy. So there's a risk of actually having twins or triplets. For some women with PCOS, they tend to gain weight, and usually this weight is difficult to lose. So dieting and taking the exercise one day at a time and being kind to yourself while exercising and dieting can also be helpful in losing weight. The last problem I'm going to talk about today that could be the reason you are not getting pregnant is what we call endometriosis. During menstruation, the inner lining of your uterus here, a third of it sheds, and when it sheds, it comes out as period blood. Now, this inner lining of your uterus is actually what we call the endometrium. So in women where this lining of the uterus is found in other parts, once it's not inside here, once it's found in other parts, maybe within the muscle, on the outer body of the muscle, in the fallopian tube, in the ovaries, it's called endometriosis. So usually, symptom of endometriosis is painful menstruation. Also, sometimes this lining of the uterus can be found in places outside of this reproductive organ, like your rectum. But the most common places endometriosis occurs are on organs that are connected to the uterus. The most common symptom is painful menstruation. So usually women with endometriosis experience excruciating menstrual pain. But how does this cause infertility? It can cause the fallopian tube to be blocked and prevent sperm from reaching the egg. That's one way it can prevent pregnancy. Another way is sometimes this retrograde menstruation can go back all the way and enter the ovaries. And when it gets to the ovaries, it just messes up the ovaries. One, it can lead to reduced quality of the egg produced by the ovaries. Two, it can cause complex cysts to be formed in the ovaries. Even though endometriosis causes infertility, just like many other things that I've mentioned today, you may still be able to conceive naturally. But in a case where you have been diagnosed with endometriosis and you have tried, you have had regular sexual intercourse during your fertile period for up to 12 months regularly without, and this has to be between a penis and a vagina, without conception, like without being successful, then the treatment for endometriosis includes pain meds. So like I said, endometriosis comes with severe menstrual pain. So you can take over-the-counter medications like ibuprofen or your Advil, Aleve, paracetamol, birth control pills. So birth control pills can help to actually control the hormones that stimulate endometriosis. But I know that you're trying to get pregnant, right? But first, let's try to control the inflammation around our ovaries. So this may take some months. Another medication is what we call a GnRH agonist. Now, what this drug does is it helps the endometriosis, that's the lining of the uterus found in all those places. It helps it to shrink. But the side effect of this is that it actually causes hot flashes, dry vagina, reduced breast tissues. So usually you're on these therapies for like a few months, like 6 months. Now, when you're ready to get pregnant, you have to stop these therapies and then try to conceive naturally, which is simply calculating your menstrual period and trying to have sex when you're most fertile. But if pregnancy doesn't occur, there's also a treatment option for surgery. But I usually don't advise surgery when you're trying to get pregnant, because if endometrioma has occurred, that is complex cyst in your ovaries, then the surgery is going to be on the ovaries as well. And then when the ovaries are healing, it will heal with minimal scarring, but this can also affect the number of eggs left in your ovaries. So if you're trying to preserve fertility and you have tried naturally, after being diagnosed with endometriosis, then another option is IVF. I already mentioned in vitro fertilization in this video already. It's simply taking the egg out of the woman, taking the sperm from the man and fertilizing outside the body, and then transferring the resultant embryo into the uterus of the woman. So that works. But remember, I also mentioned that with endometriosis, the quality of the egg may be affected. So if that is your case, then a donor egg is advised. A donor egg is simply taking the egg from a younger lady without endometriosis and who has like all her fertility parameters normal. This is usually done with IVF. This has been a very extensive video. I've mentioned a lot of reasons, a lot of possible causes, for infertility. So if you have to pause or rewind or even make jottings, you do that. The most important thing is understanding your body, understanding that infertility can be as a result of male factors and female factors, and then knowing the right next step for you. As usual, I am rooting for you. And if this video helped you, share with other people, and see you in my next video.